Hey everyone, my name's Dr. Wes, and I work at Pediatrics. I just wanted to talk to you a little bit about something that's popped up in the news lately, and that's acute flaccid myelitis, or AFM for short. And kind of defining the term, acute is all of a sudden onset, flaccid just meaning a loss of tone, and then myelitis meaning kind of a disconnection between the nerve impulses and the muscle tone, the muscle strength. So it's a concerning illness or disease process because it affects children mostly. Most of the cases have been confirmed in children. And a lot of the questions we've received recently, I've had several questions each day for the last week about AFM. But those questions are like, what causes it? How do we identify it, or how do we recognize it, and what do we do? So what causes it? The CDC has listed a few possible causes, including several viruses, enteroviruses, kind of some cousins of what we used to have trouble with, or polio, and adenovirus, another common cold, as well as some mosquito-borne illnesses. So things that we can do to prevent the spread of these diseases, and then potentially reduce the number of future cases of AFM would include things like washing your hands thoroughly, especially after daycare, after school, or during school, or at the workplace. And that's washing your hands with soap and water, not just rubbing with an alcohol cleanser. Other things, because some of the causes have been linked to mosquito-borne illnesses, limiting mosquito exposure. So that's getting rid of that standing water in the pot in the backyard, or wearing DEET when you go outside during high mosquito hours, especially in warmer climates. And then also wearing brighter colors, just avoiding mosquito hours, so dusk and dawn. And then also sometimes we don't have a cause. So recognizing new symptoms such as weakness in one arm, or one leg, or both legs. So if you notice that your child's a little more clumsy all of a sudden, or you're concerned about any new weakness in your child, please feel free to give us a call here at Gwinnett Pediatrics. Again, it's an extremely rare disease process. There are about 400 cases in the last 4 years or so, and it's 1 in a million. A few other diseases are a little more common as far as nerve diseases, and they're still 8 to 10 in a million. So it's a very, very rare disease, but please call us if you have any questions.